Hi, this is Thorman Norman. Um, just wanted to give you my views on the movie SiCKO. I watched the movie. There was some good points in there. Definitely some disturbing facts. But I will say I did not see a solution or a call to action that made sense to me from that movie at all. If Michael Moore is trying to say that the solution for our current system is a government system of healthcare, socialized healthcare, that just won't work. And it's really just common sense. If you're moving from an HMO, which is a large bureaucracy which funnels money out of the patients and doctors, that's a problem. But how is that going to change if you have the federal government replacing the HMO, which the federal government is just another bureaucracy? It's still a three-party system where you have the patient, the doctor, but then you have the third party. That system is just inefficient because it's always, always, always more efficient, more effective to have direct negotiation in any situation. Healthcare is no different. And what I mean is, if you have to negotiate through a third party, you have some leeway, you have some ways to manipulate it. A doctor can do some things that can get more money, or obviously a lot of doctors are just having a hard time getting paid at all. But when you have a direct negotiation between a patient and a doctor, that's direct face-to-face negotiation. That's always more effective and more efficient. Okay, that's why the free market always works. The free market works because you don't have the government in the way. Okay, so I see that the movie really did not show that. To me, it looked like Michael Moore was simply trying to push for. It doesn't seem like it. It's pretty obvious. He's trying to push for a socialist type healthcare system, which anytime you put a bureaucracy into play, you're going to create that level of bureaucracy which needs to be paid. I mean, it's just common sense. Government officials do not work for free. It's not charity work. So when you put all this layer of bureaucracy in there, all these people need to be paid, and that just doesn't work. Okay, I mean, it's just common sense. Where is that money going to come from? It's going to come from hardworking Americans who pay their taxes. And where's that money going to go to? Well, a little bit of it's going to go to the doctors. A little bit of it's going to go to the health care that you receive from those doctors. And a little bit of it, or maybe unfortunately a lot of it, will go to the bureaucracy. So it's just a funneling system, and it's a way for another excuse to tax people and take money away from people and to the government officials and to the various things that they support, various corporations they support, various things that they would subsidize. So again, to me, it's not a good system. The solution that I see is a free market system. Get the bureaucracy out of it, okay? You have to have people in control of their own health care. For example, one solution may be to have a tax-free savings program where you can save your money in a program where you can use that towards health care, okay? And that would be much, much more efficient, much more effective than creating huge bureaucracy to replace the huge bureaucracy, which is the HMO. So it's just jumping from one to another, and it's the same thing. So that's one solution I see. A lot of people, and actually Michael Moore, I've seen him on several programs saying, well, what about the fact that, you know, if someone doesn't have insurance, okay, and they're at a hospital and they're dying, what are we supposed to turn them away? No, I don't think so, but I don't think the government is smart enough or can efficiently and effectively provide for people who are uninsured. Okay, I think that needs to be done at a local level. Okay, whether it's the hospitals, whether it's local governments, definitely not the federal government. I mean, look, anytime the federal government gets involved, it's just a huge, huge layer of money being removed from what they're trying to help you with. Okay, so it just doesn't work. I mean, it's just simple common sense. Okay, so anyways, hopefully the different comments out there. I'd like to see more comments on, more than just one or the other. It seems like Michael Moore's film there's two extremes. I definitely see a middle point where you can use the free market system, where you can use, you know, the supply and demand, where you let people keep their money, get the government out of their pocketbooks, and let people handle their own health care much more effectively, much more efficiently, one-on-one negotiation with the doctors instead of all this third-party inefficiencies, I should say. So that's my comment, and everyone, peace and love.